Good afternoon, everybody. Thanks for joining us for, I don't know, it feels like the 100th webinar in the 2021 OSHA webinar series. There's been so many unexpected twists and turns this year with a lot of impromptu and emergency webinars. We're at July, so ordinarily it would be the 7th, but I think there's probably been about a dozen or so. And thank you, so many of you, for joining us for all or most of those. And thanks for joining us today. Today we're a little more than halfway into the year, and we thought this would be a good opportunity to take a look back at what we've learned from and about OSHA under a Biden administration, and talk about some of the major developments that have already occurred this year, and then look ahead a little bit to what we can expect over the balance of this year and the balance of President Biden's term. The first voice that you're hearing here is Eric Kahn. I'm one of the founding partners of Kahn Maciel Carey, and I chair the firm's national OSHA practice. I'm joined today by a couple of my partners, Amanda Walker and Aaron Gelb. I'll let them introduce themselves real quickly, and we'll jump in.
Good afternoon. Amanda Walker, joining from Atlanta, and I have been an OSHA attorney for a number of years, more years than I'll admit to at this point. And I've been working with Kahn Maciel in our practice group for about 10 years and work with clients that have OSHA issues, whether it's compliance, litigation, or seeking interpretations or variances.
And
Aaron?
yes, thanks, Amanda. And this is Aaron Gelb. I lead the firm's Midwest OSHA practice out of Chicago. Currently out of the home office, kind of moving back into the actual brick and mortar office downtown across the street from the regional office, Region 5 office. And like Eric and Amanda, handle all manner and aspects of the OSHA practice, from inspections to consulting and auditing and litigating contested citations.
Excellent. All right, so here's what we're getting into today. We're going to take a look at just the first few months of the Biden administration, but already with some significant organizational updates. And we'll talk about the senior leadership that's been installed there or that's coming very soon, as well as some other administrative changes and additional staffing and things like that we're already seeing at the agency. And then, as I believe we are all contractually obligated to talk about COVID at least 25% of the time in any speech we give this year, we're going to get into COVID, of course. That has been the highest it was the highest priority of candidate Biden, has been the highest priority of President Biden, and has definitely been the highest priority of OSHA under a Biden administration. So we'll talk about how the agency has responded to the COVID-19 pandemic, including major developments over the last couple of months with the emergency temporary standard and new workplace guidance. We'll get into enforcement as well on the COVID-19 front. And then we'll get into everything else that is on OSHA's plate other than COVID-19, including sort of a general OSHA enforcement update, as well as a general OSHA regulatory rulemaking type of update. So getting started with the new people in place at OSHA. This is one of my favorite graphics I've used a few times, that we just experienced a really bizarre set of years over at OSHA. We went through an entire presidential term without an Assistant Secretary of Labor for OSHA. So this is not the Capitol after January 6th. This is supposed to be the front office at OSHA, where no one ever moved in. The office had been abandoned. Well, things have changed pretty dramatically at OSHA under a Biden administration. The administration has prioritized filling senior leadership positions at OSHA, and has already, really on the first day in office, President Biden's first day in office, installed a Deputy Assistant Secretary of Labor for OSHA, which is a non-Senate approval position. So he was able to get in place essentially immediately. And the fact that that happened was a big deal, that we did put somebody in place, or OSHA did put somebody in place immediately, showed the kind of new prioritization of OSHA under this administration. And shortly after that, a nomination was announced for the Senate approved position, the Assistant Secretary of Labor for OSHA. We'll talk a little bit about the individuals that have been tagged for those positions and that are already in those positions. And then the other thing that we've seen is a substantial additional funding flowing to OSHA in a couple of different ways. One was through the major, COVID relief legislation, sort of the hallmark legislation of this administration so far, included, among the checks that were going out to individuals and some of the other relief that was included in that law, there was $100 million that was targeted to go to OSHA, with a substantial chunk of that intended for COVID enforcement. And what does that mean? Money for COVID enforcement. It's being used by OSHA to sort of ramp up its staffing, hire a bunch more kind of boots on the ground, compliance officers and other enforcement personnel. In addition to that $100 million boost to what is, traditionally a relatively small budget agency, we've also seen some additional money being requested in the blueprint budget from the White House, as well as the budget that's already been passed by the House of Representatives. Substantial increase in OSHA's budget, principally for staffing up their field offices and their enforcement staff. So who are the people that are in charge at OSHA right now? That position that we talked about that was filled essentially on the first day in office for President Biden was the Deputy Assistant Secretary for OSHA, and immediately, sort of tagged as the acting head of OSHA, and that was Jim Frederick. Jim Frederick has spent 25 years as the number 2 in the safety department at the United Steelworkers, major national union. And so that sort of union credential is no doubt how he got to the top of the list for this nomination under the Biden administration. But one thing that's a little bit unique about Jim Frederick, and one that has been encouraging to us, one that we were pleased to see this nomination and putting Jim into that position, is that Jim spent some time between his role at the USW and this job at OSHA as essentially a management side safety consultant. He was working with ORC-HSE, which was ultimately acquired by or merged with National Safety Council. And so, even if Jim did spend a couple of decades thinking that all employers are evil, he had a very positive experience over 3 or 4 years or so working with employers and realizing that, on the safety and health side, most employers get it. We work hard to advance the cause of safety. We're on the same team, the same page as OSHA and unions on the safety and health side. And I don't actually attribute to him any sort of sense that employers were evil before that. But he had, I know, a positive experience working with employers, including some of our clients, to enhance safety programs and to try and get labor and management on the same page on the safety and health front. Did a terrific job at that. The other thing that's great about Jim is that he is a bona fide safety professional. You see some people coming into this role with policy backgrounds, some people coming in with various different backgrounds, but Jim is a bona fide safety professional. He served on over his career, dozens of different technical safety committees for standard setting bodies like ANSI, like ISO, worked as a labor representative on NIOSH boards and things like that. Really gets safety in that, sort of basic manufacturing industries, and was that you're going to get somebody kind of from that labor side in a Democratic administration, where we think Jim Frederick was as good a pick as we were going to get to have somebody who understands management side, understands employers' positions, and is willing to listen. And so he's been in that job basically since the first day of this administration, has been obviously very much involved in major policy decisions, rulemaking activities, enforcement decisions, mostly around COVID-19, because that's what has been the highest priority of the agency. One of the biggest developments of the year that we're going to be talking about is that, where there was this big push to have a broad, all industry, all employer COVID-19 regulation, we ended up with something narrower than that. No doubt with Jim as, on the senior leadership at OSHA, at the Department of Labor right now, probably had a role in that decision making. So it's interesting to see how that played out. Now, somebody who probably would have taken a different approach and pushed harder for that broad all industry, all employers COVID-19 rule is Doug Parker, who is President Biden's nominee for the top job at OSHA. Jim Frederick is the acting head of OSHA. Doug Parker, if confirmed by the full Senate, will become the head of OSHA, permanent head of OSHA. Doug Parker has been, and I believe today still is, he's not left this post, even during this confirmation process for federal OSHA. Doug has been the head of Cal OSHA, the division chief at Cal OSHA, for over 3 years now. And before that job at Cal OSHA was the head of a group called WorkSafe, the executive director for WorkSafe, which is it's not a union, but it's a big worker advocacy, labor advocacy organization, principally out on the West Coast. And before that job with WorkSafe, Doug was in the Obama-Biden administration in a senior role, or a couple of different senior roles at the Mine Safety and Health Administration. And before that, had a series of jobs either directly with major national unions or at a law firm that represented major national unions and small local unions. So Doug, not unlike Jim Frederick, brings to the table serious, big labor credentials, has been on the side of unions, either with them directly or advocating for them for many years. And then most recently with his tenure at Cal OSHA. And Cal OSHA, even as Fed OSHA goes back and forth between Republican administrations and Democratic administrations, Cal OSHA is always that steadfast, progressive agency. And we saw, during his tenure, only 3 years, but during that 3-year tenure at Cal OSHA, a lot happened that is really relevant to what we might expect to see happen if and when Doug is confirmed at Fed OSHA. Most notably, Doug oversaw the emergency rulemaking process for Cal OSHA's COVID-19 emergency temporary standard, and really the implementation of their aerosol transmissible diseases rule, which is not unlike the emergency standard we have at Fed OSHA now, focused on healthcare. But Doug, believed that this issue, this COVID-19 pandemic, was a major workplace crisis, not just a healthcare crisis, not just a public health crisis, but a crisis in all workplaces. And so he oversaw and pushed for and got an emergency standard that applies essentially to all employers in the state of California. It is, I think, maybe there's a debate about, Oregon or Washington's rule, but I don't think so. I think it's pretty clear that Cal OSHA's emergency standard was the most onerous of any that we've seen, certainly more so than Virginia, and certainly more so than what Fed OSHA ultimately issued. Doug has already gone through a confirmation hearing with the Senate Help Committee and has cleared the Senate Help Committee, is just waiting now for a full vote of the Senate to be confirmed. During his confirmation hearing before the Senate Help Committee, this was at a stage where, the new cases and deaths were approaching, record lows. The vaccination rollout had been and was demonstrating to be very effective. And it felt like, we were entering that stage where it felt like, hey, we were beating the pandemic. We were in great shape. And despite that, and despite a lot of pressure from the senators who were questioning him at the confirmation hearing, Doug was steadfast in his testimony that we needed to finish the fight. There was still very much a need for a broad all-industry COVID-19 emergency rule. That rule should be, onerous and strong, and that it still met, that the conditions in the country still met the requirement for an emergency rule, that there was still a grave danger for which only an emergency standard from OSHA could adequately address that hazard at workplaces. So we know what his position is on this, and who knows what happens if he is confirmed by the full Senate while we're still battling the Delta variant, while cases are ticking up a little bit, still very low relative to where we were last year or the very beginning of this year. But with Doug Parker confirmed, I wouldn't be terribly surprised to see the agency revisit its decision to issue a narrow healthcare industry only rule. But that's one of the major things that Doug was involved in. He was involved also in the rollout of Cal OSHA's workplace violence rule. It has been overseeing the rulemaking for an indoor heat illness rule and enforcing the agency's outdoor heat illness rule. and has overseen what is, I think, generally considered to be the most aggressive, enforcement-minded OSHA agency in the country. That's who has been picked to come in and run Fed OSHA. So I think we get sort of a signal for what we might expect from OSHA over the balance of a Biden administration if Doug is confirmed. We think that's going to happen. We were talking about it this morning. You know, we've seen, obviously, Labor Secretary Marty Walsh has been confirmed. Now his deputy Labor Secretary, Julie Su, also out of California, California's Labor Secretary, has been confirmed. The Solicitor of Labor has just been confirmed. So it seems like those top level jobs at Labor are done now. Now would be the move to the undersecretary positions like the Assistant Secretary for OSHA. And I think Doug was perhaps the first of the undersecretary positions at Labor to be nominated, whose nomination was announced. So it wouldn't be terribly surprising to see Doug Parker be the first nomination taken up at that level. And we could see that happen really within the next month. So we could see Doug Parker installed at OSHA very soon. So let's talk now about the agency's approach to COVID-19. And we talked a lot, many of you I know joined us last year for a bunch of webinars where we got into COVID-19 and how the Trump administration was handling the pandemic. Now we'll talk about how things have changed as we've moved into the Biden administration. The most notable thing, and still this, I think this is pretty, interesting as a big OSHA nerd and somebody who's practiced in this space for over 20 years now. On his first full day in office, President Biden issued an executive order all about OSHA and COVID-19. And that is, for many of you who handle EH&S, right, the environmental piece, no big deal, right? There's probably 5 to 10 executive orders about environmental regulatory issues, about EPA, every time you transition to a new administration. Well, this was the first time ever that any president on his first day in office issued an executive order about OSHA. So big deal, showing again that kind of high prioritization this agency has in a Biden administration, at least during this pandemic, and I think more broadly, a really high priority agency for the president, period. But on that day one executive order on protecting worker health and safety, President Biden ordered OSHA to do 4 things. The first 2 were all about enforcement, just generally enhance your COVID-19 enforcement response, and more specifically, implement as soon as possible a COVID-19 national emphasis program so we can marshal resources into workplaces more quickly. I'll talk about the other 2 that are more policy type issues in just a second. Let's talk about these 2 enforcement related elements of the executive order. The major one was that national emphasis program, ordering OSHA to issue a national emphasis program very quickly. They did that less than 2 months into the administration. OSHA had launched a COVID-19 national emphasis program and this is right out of the directive, to focus the agency's inspection and enforcement efforts on companies that are putting the largest numbers of workers at serious risk of contracting the COVID-19 virus. And this was another major element of the NEP was to focus on retaliation. This has been one really unique element of the COVID-19 pandemic, has been the absolute surge in employee complaints to OSHA about safety and health issues, and presumably the surge in employee complaints to employers about COVID-19 issues. We don't have a response plan. Our response plan isn't robust enough. We're not enforcing our COVID-19 protocols. Employees aren't wearing masks. We're not doing enough to address this hazard in the workplace. And OSHA has been taking a lot of action in response to those complaints. And as a result, there's a lot of consternation about adverse employment actions against employees who raise concerns. And so the NEP is focused heavily on that as well. The NEP was effective immediately back in March. OSHA was doing a little work to build the inspection lists that would be part of that. But immediately inspections could be done under the NEP and were being done under the NEP right away. The same day that OSHA launched the National Emphasis Program, they also issued an updated Interim Enforcement Response Plan. And that is the written plan that sort of guides how OSHA conducts inspections related to COVID-19 and just more broadly during the COVID-19 pandemic. One of the major elements of that response plan during the prior administration had been a sort of tamping down of on-site inspections. Do as much work remotely as you possibly can do. Well, the major change in the updated interim enforcement response plan was, all right, OSHA, get back out there. We need you out in the field. We need you in workplaces. That's the way we're going to, drive real change in employers' response to the pandemic. So do more on-site inspections. And here's a national emphasis program that requires you to do basically a quota of a certain number of inspections on this COVID-19 issue. The emphasis program required OSHA to develop 3 targeting lists. And if you looked at sort of how those lists were defined, it really showed you that the idea was we want you to get everywhere. There was high-risk healthcare, high-risk non-healthcare, and non-healthcare critical infrastructure, which is a huge swath of America's workplaces. Recently, very recently, just within the last two weeks or so, OSHA updated the National Emphasis Program target lists and removed that non-healthcare critical infrastructure. And I think the point here was that OSHA had just issued its emergency temporary standard focused on healthcare. And so they wanted to really refocus most of their inspections on healthcare employers to enforce the new emergency temporary standard. But they did still leave in high-risk non-healthcare workplaces. And most importantly, in the National Emphasis Program Directive, it talks about expanding any inspection that begins for literally any reason. If OSHA identifies potential COVID issues in your workplace because they're there for, an incident about forklift operations, or they see employees without masks, they're going to expand that inspection to cover the COVID-19 National Emphasis Program as well. And then certainly other employee complaints or reported deaths related to COVID-19, they're going to do an NEP inspection regardless of whether you're on one of those program lists. A couple other interesting points about the NEP is that if you were already inspected, if you have already received a COVID-related inspection at any point during the pandemic, that doesn't remove your name from the list, which would typically happen in emphasis programs, where if you've already had a comprehensive inspection or an inspection about whatever the hazard is that's addressed by the emphasis program, you're supposed to be removed from that list for 2, 3, 5 years, whatever it is. That's not happening here. And I think the purpose is sort of a slap to the face of Trump's OSHA, is to say, we don't think that, the agency was doing enough. We don't think there was enough enforcement. We don't think the agency was taking this seriously. So even if you got a visit from OSHA or had an inspection opened by OSHA under the prior administration, we don't think that was enough scrutiny. So we're going to do it again. And so that, if you've already seen OSHA, you're going to potentially see them again. Several of the state plans have adopted similar emphasis programs, but not all of them. The emphasis program does not have a small employer exemption or exclusion. So employers, regardless of size, can see one of these emphasis program inspections. A lot of money, as I said before, has gone to OSHA under the COVID relief law. Most of that money is intended for enforcement of COVID issues. And so as a result, we're seeing a big increase in hiring, but we're also seeing OSHA set a target for itself of doing at least 5% of its overall enforcement efforts during this year to be conducted under this national emphasis program. So that will likely be around 2,000 inspections under the emphasis program. So there's a little bit of data here, nothing too interesting yet, because it's still, awfully, the emphasis program's only been around for 2.5 months, something like that. So we've not seen a lot of data yet on that front, but a couple of interesting points. One, over the entire course of the pandemic during the Trump administration, we saw about 1,500 COVID-related inspections just since the emphasis program was launched in March, in mid to late March. We've already seen 600 NEP inspections and over 1,000 total COVID-related inspections just in a few months. So we expect that number to be quite a bit higher. In the entire year of COVID enforcement under the Trump administration, about 280 COVID-related citations, already over 200 COVID-related citations just during the first few months of the Biden administration. Only 3 general duty clause citations, period, under the prior administration. All 3 of them were meatpacking facilities. 2 of them were to the same employer at 2 different locations. We've already seen 5 times that number of general duty clause citations issued under the Biden administration, and it's been across a pretty broad and diverse range of industries that are seeing those citations. And we've already seen at least 2 of those characterized as willful, and none of the prior citations had been willful. One thing that has remained the same, though, to this point, or up to this point, is that the most citations that are being issued related to COVID are around respiratory protection. These would be workplaces that are introducing N95 masks for the first time just because of COVID and not doing fit testing, not doing medical evaluations, not introducing a written respiratory protection program. That actually continues today to be the most frequently cited set of standards under the Biden administration. That is probably going to change now that there is an emergency temporary standard and the NEP is heavily focused in healthcare. I would expect to start to see a ton of ETS-related citations being issued. Now, I think we'll hand it over to Amanda to talk about the other major elements of the executive order, which are, really policy, rulemaking, and guidance that OSHA is required to issue, has issued, and has started to enforce.
Good afternoon. So the executive order that Eric had mentioned that came out the first day of the Biden administration back in January had a provision in it that said that OSHA needed to consult with the CDC to see if any workplace guidance or if any sort of emergency temporary standard was needed to address the COVID situation. These were things that had been bounced around in the prior administration under Trump. There certainly was guidance out there, but OSHA decided to take a fresh look at it and reissue it. And they decided that there was a reason to go forward with promulgating an ETS. An interesting note, there had not been a previous ETS, an emergency temporary standard, since the early 1980s was the last time that OSHA had issued one, and it related to asbestos and lowering the Pell. So it was something that OSHA has not had great success with. They're often challenged in the courts, and a couple of them have been invalidated. But it was something that was brought up in the executive order, and so it was something that was considered by the agency. Moving on to the next slide. And OSHA was considering it an ETS. Initially, we all thought that it would likely be for general industry. This was back in January and February, where COVID positivity numbers were pretty high. We had the big surge at the holiday season, and the hospitals were talking about being at maximum capacity. And that was the environment when they started to discuss this ETS. OSHA had worked on it. They definitely had some background information to collect on or build on from their infectious control standard that had been developed or worked on in the previous administration. I think that was the Obama administration and had been tabled for a number of years. Finally, they get a draft rule together, as is normal procedure when going through the rulemaking process, even though this one was slightly different since it was an emergency temporary standard and time is of the essence. It still has to be transferred over to the Office of Management and Budget, the regulatory office over at the White House that reviews the standards and looks at the feasibility and basically gives the administration input into it. There's usually some discussions, some back and forth, and OMB takes meetings from outside sources to try to understand or listen to concerns of the regulated community. So they were moving forward with this ETS because they had determined that an employee exposure to this new hazard COVID presented a grave danger in every shared workplace in the United States. The ETS included provisions for all industries, and we'll talk about that in a second. The ETS that was delivered over to OMB back in April was broader. It was and covered more industries, different from the one that we saw that was finally issued. And with regards to small employers, they would have also been covered. OSHA emergency standard. It was sometime in June, early on a Monday. There was an announcement that the Secretary of Labor had indicated that the ETS would be coming out shortly. A draft copy was posted the next day, where we found out that it was only going to be applicable to the healthcare industry, which was kind of a shift. There had been discussion about it, but still a lot of uncertainty as to the applicability of the ETS, and was still that uncertainty until you saw something in writing. OSHA issued it. This narrower scope was likely due to some of the progress we saw with regards to combating the virus in the early months of this year. Vaccination programs were successfully being rolled out. People were getting shots. Our number of COVID cases was declining. Number of hospitalizations was declining. And then one thing also that certainly probably influenced their decision in the scope of the standard is CDC's guidance, relaxing of the COVID protocols. I think we were all kind of caught flat-footed and a little surprised by CDC's determination that, or recommendation that vaccinated individuals no longer needed to be masking. So I think all of these factors were working together and taking place during the 6 months that OMB was reviewing it, leading to the narrower scope. I had mentioned that they were taking stakeholder meetings. 51 stakeholder meetings occurred with OMB. I'm pretty sure all of them were virtually, and different regulated interests were going in and talking about their experience with COVID and what they had found to be effective, and concerns that they had with provisions that might actually be in the ETS. So on 6/10, 16 months into the pandemic, OSHA comes out with this new ETS, and it is only limited to the healthcare sector. It was actually kind of an interesting document to read through. The scope and applicability section and all the exemptions and exceptions for how to get out of the coverage was rather, I thought, for an OSHA rule, kind of convoluted, interesting. They decided to limit it to healthcare. This has been challenged by the AFL-CIO. They have filed this suit, I think, in the DC Circuit. Yes, DC Circuit. And their intention is to say that this ETS should be broader. This is something that's ongoing litigation and is still pending in the court. Going on to the next slide. As I just mentioned, it's been challenged in the DC court. Certainly their interest in having it covered other industries such as meatpacking, some of the other industries that you've heard that there was particularly significant COVID issues with. And, it's yet to be seen. I don't believe that there's been any filings in this case, but, one thought is OSHA might not be vigorously defending these legal challenges that might result in a broader scope of the ETS than what we currently have right now, which only applies to healthcare. Moving on to the next slide. In the meantime, does the ETS apply to you? On a very high level, ETS applies to healthcare services and healthcare support services. OSHA defines healthcare services as services to individuals by professional healthcare practitioners to promote, maintain, monitor, or restore health. Usually that somebody is going to be a licensed healthcare practitioner. And then gets a little murkier. They also include healthcare support services, services that facilitate the provision of healthcare. OSHA provides examples in the preamble such as laundry, janitorial services, housekeeping, food preparation, maintenance in some situations, especially if the maintenance department is in-house at a hospital and it takes care of the infrastructure where the healthcare services are provided. OSHA did do a cost analysis, an economic analysis for this ETS, where they had to break down all the different entities that they thought would be covered by it. And here on the right side is a list of kind of high level of those entities that OSHA projected would be covered by the ETS. Pretty much, there's a couple that might find interesting, but temporary labor. This would be the staffing for healthcare professionals, a lot of traveling nurses, and then also healthcare facilities and manufacturing workplaces, which was one that a lot of people might not necessarily expect right off the bat with regards to applicability of the ETS. Moving on to the next slide. I'm talking a little bit more about the counterintuitive coverage. You might not have thought that retail pharmacies would be covered, but they've been pretty instrumental in helping with the COVID situation as far as providing COVID testing and now COVID vaccinations. OSHA had indicated in their rule that retail pharmacies would be included unless they were only prescribing or administering, sending out prescriptions. If they provided other services such as COVID vaccinations or COVID testing, that exception would not apply to them, and the ETS would, they would have to follow the ETS and develop a COVID-19 plan. There's some other possible exceptions that could apply to them. It was a little unclear whether those were, how that all worked, but I think that that's kind of worked itself out. I think retail pharmacies, as long as they're doing screening of patients that are coming in for vaccinations, they're screening to determine that they don't have any COVID symptoms, and they're precluding anyone who has a suspected or confirmed case of COVID from that area. They are eligible for one of the exceptions in the rule. Other places that we didn't necessarily think of right off the bat as being covered by the ETS is those walk-in clinics, the minute clinics that you might find in a Walgreens or another retail setting. The medical clinic and a manufacturing facility. A lot of large manufacturing facilities have their own wellness centers, and finding that those are covered under certain circumstances. It kind of depends on the services they provide and how they handle COVID. But that was another one that was not immediately apparent off the bat. And then non-patient outcare services. So maybe that would be dialysis or some other outpatient care service, and whether or not they apply. There are exceptions, and just talking about the exceptions here, I mentioned the pharmacist one. You get out of coverage of the ETS. You don't have to have an ETS plan and all the other provisions that are in the ETS if you're a pharmacist just dispensing prescription medications in a retail setting. You have to do a further evaluation if they're providing more services than that. Just depends on the circumstances. Another one that is then probably a lot of different healthcare providers are eligible for this exception is the non-hospital outpatient settings where non-employees are screened for COVID-19 symptoms and suspected or confirmed COVID-19 cases are not permitted to enter. This might be a podiatrist's office where you're doing pre-screening of the patients coming in, trying to identify if they have any COVID symptoms, and if they do, telling them to reschedule, and making sure that even anybody who's in the workplace for more than just dropping off the mail or dropping off a FedEx package would also have to be screened to determine that they don't have the COVID symptoms. And then you would be eligible for this exception that OSHA lists in the beginning of their ETS. There's also an exception for when first aid is administered by an employee. Some folks have a safety group that administers first aid if somebody's hurt in the workplace, and OSHA allows an exemption for that as long as those individuals are not required to be a registered healthcare professional, such as an RN, EMT, that sort of credentialed individual. And I think that I'm turning it back over to Eric for guidance.
I think Aaron actually.
Oh, sorry, Aaron.
Oh, all good. Yeah. So hi again, everyone. This is Aaron Gelb from Chicago. When the same day that OSHA unveiled the ETS that Amanda's been describing, also released general industry guidance, which I think most employers were aware of and have been addressing and using, following in for the past month, but it has gotten lost in the shuffle somewhat. And I think one of the challenges that employers are facing with this new guidance, and the question that we're getting asked and really trying to sort through is kind of what is the import of the guidance. Obviously, OSHA issued guidance way back when, at the very outset of the pandemic in March of 2020. And then we went through this pretty long period where it was really kind of pointing the finger at CDC and encouraging employers to follow the CDC guidance. And we saw in the course of the number of inspections that we've managed during that period, where it really was lots of questions during witness interviews from the compliance officers and document requests, trying to determine what sort of a program or protocols that the employer had in place. I defended witness interviews where the HR director specifically asked, how often did you check the CDC's website? What did you have in place to determine when new guidance was issued? We knew from conversations with folks in the regional offices that generally each region or even area office had someone who was kind of tracking when the guidance changed, so they'd be able to go back and determine if someone was doing that. We had one inspection where it was clear that OSHA was even kind of following what the state of Illinois was doing with respect to food service and restaurant rules to determine if the employer's cafeteria was complying with it. So there was this kind of a little bit of I would say a gotcha approach to the CDC guidance, but OSHA really wasn't providing any or substantial guidance in that regard. Occasional documents came out, and then as Eric talked about, when President Biden took office, one of the directives was to issue updated guidance, which happened in January, towards the end of the month, and then fast forward to June, and this new guidance drops. And so the question then is, what do we do with this, and what is the import of it? And I think the question, so then we're looking at, does this mean it's, as you can see on the screen, I mean, guidance is not a standard. It should not be creating enforceable obligations or duties. But I think, we asked this question, is it the tantamount? Is it essentially a backdoor rule? And certainly I've seen circumstances where it appears to be. I've worked on one inspection for an employer that had what I thought was a very impressive and robust set of COVID protocols, a number of basically complying with every aspect of CDC guidance, had mechanisms in place to track changes, had been masking since the very beginning, distancing since the very beginning, and a small number of perhaps, whether it's whatever you could consider, or OSHA might argue is a defect or one slip up, which I would say would be more equivalent to if you had a standard and OSHA could point to, hey, look, yes, you have all these other elements of the program, but you don't have this one element. Therefore, we're going to cite you for this one issue. So, like you see with, for example, PPE, if you haven't done the PPE certification, but you have every element of your PPE program in place, they could still cite you. And in my experience, that is essentially what we're seeing, or seeing in certain areas. So the import of that is that you need to take this guidance seriously. You should be conducting gap assessments between this guidance and the programs that you have in place. So you are prepared if you are inspected through whether it's in response to a complaint, through a reported fatality, or pursuant to the national emphasis program that Eric talked about, that you can explain why you're not doing certain things in the guidance, or what steps you've taken to adopt and implement the guidance. And so what is the upshot of the new guidance really is to protect now your unvaccinated workforce, or the unvaccinated workers in your workforce. And Amanda talked about that CDC guidance that came out, I think it was May 13th, that caught many folks by surprise. And what was communicated as part of that, which I found most significant, was the fact that from the CDC's perspective, that fully vaccinated people are not at risk for serious health conditions, serious reactions, or death. And with that, but that takes you out really of the risk of a general duty clause citation with respect to your fully vaccinated employees. But what it does mean is that you still need to have mechanisms and protocols in place to protect your unvaccinated workers, and that should be your focus. I think also consistent with the messaging and the focus of the Biden administration, there is significant focus on incentivizing vaccinations within the workplace, or having you incentivize your employees to get vaccinated. And then there are also links that are shared to up-to-date CDC guidance. There's a host of industry-specific guidance as well. So then look, what are some of the suggested actions or steps that we see in this most recent guidance as part of this incentivizing vaccines? One recommendation is to provide paid time off for employees to get vaccinated. I think we're certainly seeing now with the Delta variant taking hold, perhaps that's going to drive some additional people who are on the fence to get vaccinated. So to the extent that employers are still offering or consider offering paid time off, that's something that OSHA recommends. Quarantining unvaccinated workers, so you don't have to quarantine your fully vaccinated workers who experience a close contact. But if you have unvaccinated workers who have been had a close contact, you should be quarantining them. And obviously, regardless of vaccination status, if you have an employee who tests positive, of course, or someone who is exhibiting the telltale symptoms of COVID, then those individuals should quarantine as well. Physical distancing and masks, kind of the two, what I would say, central pillars of any effective COVID-19 plan are still in place, again, for unvaccinated workers. So we're seeing a whole mix of employers that are either relaxing or removing these restrictions with respect to the fully vaccinated, but maintaining them for those that are not. Some, of course, are maintaining them across the board, regardless of vaccination status. But certainly you have that ability under this guidance to remove or relax those requirements for your fully vaccinated employees. In what is implicit then in the guidance is that you need to verify vaccination status. We get this question a lot. Can we just go with the honor system? In our view, that is not acceptable. I don't think that if you're in the midst of an inspection and a compliance officer is walking through your workplace and sees a number of people who don't have a mask, and if they ask the person who's showing them around, are those folks fully vaccinated? I see that they don't have a mask. If you can't confirm that or explain how you know that, I think you run the risk of a citation. How do you go about doing that? I think there are a number of ways to do that. I think whether it's a self-attestation, whether it's viewing cards, vaccination cards, and keeping a log, we tend to advise against actually taking possession and copies of the cards, because then you have some particularly burdensome record keeping or record retention requirements. But ultimately, you have to have a method to ascertain and then document status, so you can then verify that the folks who are going without masks are indeed fully vaccinated. And of course, essential element of any program, and COVID-19 is no exception. Continue to train employees on your policies, any changes to those policies, any updates, and whatever protocols or procedures that you have in place. Certainly training new employees so they're familiar with what is expected of them as well. Some additional suggested actions. I think one, if you have employees that are in contact with members of the public, the suggestion is, or you should suggest, that unvaccinated customers and guests wear a face covering. Again, this is another thing that some employers are still requiring it. I would say certainly in my experience where I've gone and traveled in the past couple of months, it's in almost every instance. I don't think I've yet been to a place that requires anyone who's entering to show a card or verify a status, but certainly to at least suggest that for unvaccinated customers and guests. Some of the other items I'm sure you're familiar with. These recommendations have been around and remain in place. but it's worthwhile noting them just to make sure that you're doing these things, maintaining your existing ventilation systems, making sure that they're functioning, if you can, to evaluate and possibly optimize the number of air exchange, the frequency of air exchanges, the maximizing the amount of, or optimizing the amount of outside air. Obviously looking for ways to keep that air as fresh as possible. Continue to perform routine cleaning. A number of our clients have shared that obviously the enhanced cleaning comes with a significant cost. The extent of surface transmission being relatively limited, looking for ways and trying to determine whether that still needs to be done. So I think with this guidance that certainly you can scale it back. I don't think that it's probably wise to completely discontinue it at this point. And certainly if you, consistent with the CDC's most recent guidance, if you have a COVID positive employee who's been in the workplace in the last 24 hours, then you would want to disinfect those areas to the extent you can determine where that person was during their time in the workplace. Continue obviously to record work-related cases, go to the extent you can determine that they're work-related, go through that work-relatedness analysis. Ideally, you're documenting the basis for your determinations. And to the extent that you have a COVID fatality that you determine is work-related, report that to the agency. That obviously is one of those considerations. If you have questions, certainly give us a call, seek counsel, because you don't want to report cases that you don't have to. Obviously, make sure your COVID plan has protections against retaliation. If you can include an anonymous complaint mechanism, that's something that OSHA likes to see. The upshot of those requirements, obviously, or those recommendations in the guidance is that OSHA wants you to listen to your employees, to give them an opportunity to provide input and feedback regarding not only the sufficiency or adequacy of your programs, but to the extent that managers or coworkers are not complying with those requirements or rules, that they have a means to raise those concerns in a way that they can do without fear of retaliation or punishment. And then, of course, to the extent you are the other OSHA standards are implicated. For example, if you're requiring respirators, that you've got a compliant respiratory protection program, that your PPE program is in place, and that you've got all those elements in effect. Those are the sorts of things, as Eric talked about, the statistics, far and away the greatest number of citations that we've seen as a result of COVID inspections are these related standards and applicable standards, not through the general duty clause. So shifting gears, I think we've completed it more than the 25% contractual mandate that Eric talked about. Talking about COVID, let's look at non-COVID enforcement. Again, just quickly cycle through a number of these. Obviously, every year in January, the maximum amounts of citations are going up. As you can see here, effective beginning of this year, serious and other than serious can be cited up to 13,653. Willful and repeat can be cited as high as 136,532. I just anecdotally, I am seeing, you read press releases, when OSHA issues willful citations, they almost always tend to be the maximum, not quite as much as repeats, but I think the agency is looking to get the most bang for the buck possible. So I certainly feel like I see a lot more of the maximum penalties, both with willful repeat citations, even as well with serious. Similarly, one of the things that we watch closely, if you've ever listened to one of our webinars about kind of OSHA enforcement generally, that we are always concerned and kind of sounding the alarm about the risk of repeat violations. Just to touch on this briefly, if you've been in this field for quite some time, that historically OSHA treated workplaces as independent individual establishments. It used a 3-year look back window, meaning if they were issuing a citation, they'd check your record for the past 3 years. If you had a substantially similar violation under the same standard, then they would issue a repeat, but only then. If it was past 3 years, you wouldn't get the repeat. And the kind of the inspection philosophy was reactive, meaning that they didn't look for reasons necessarily to come out to your workplace. They'd inspect, obviously, if there's a complaint or an incident. And then during the Obama-Biden administration, you saw the shift in focus where instead of treating workplaces as individual establishments, there was this looking at all of your workplaces as part of one big corporate family. And so if you have a citation in Illinois, and then there's a similar citation issued in Dallas, they're likely going to do that one as a repeat. The period was, the look back period was expanded to 5 years, which means you need to keep your record clearer or cleaner for that much longer. And we certainly see a lot more proactive targeting, meaning follow-up inspections, making a point of coming back out to check to make sure that you've completed the abatement and that you don't still have the same issues that you were cited for. And for those employers that struggle with those issues, that obviously can mean a lot more repeat citations. Just as Eric talked about, this really unprecedented period during the last 4 years where we didn't have a head of the agency. Similarly, expectations that we had as far as OSHA kind of pulling back to returning to that 3-year look back period, to resume kind of more of a reactive inspection approach, to change the successorship and not necessarily treating employers work sites as one big family. None of those things came to pass. And as a result, as you see on the next slide, the percentage of citations that were issued or as a repeat violation continued consistent with the trend that we saw at the end of the Obama-Biden administration. So when you look at 2015, 2016, it was high 4, low 5% of the overall number of citations were issued as a repeat. And that has continued. And in fact, as you can see, in 2017, it was up to 5.5. It dropped below 5% just barely in 2019, and then in last year in 2020, right back to 5.3, meaning that it continues to be a central tool in OSHA's enforcement toolkit to drive compliance, to use repeats as that stick, if you will. And as a result, when you're issuing more repeat violations, when you're issuing willful citations, you get more $100,000 penalty cases. Obviously, if you're issuing a series of serious violations, it's going to take a number of serious violations at 13,000 plus to surpass 6 figures. It only takes one repeat or one willful violation. And so I think perhaps among the biggest surprises that we saw during the Trump administration would be the number of $100,000 penalty cases, particularly in 2017, where you had the highest number ever at 218. Although it dropped off a little bit in 2020. And I think a lot of that had to do with COVID, obviously. OSHA was not going into workplaces with any regularity, and in many cases, not at all. It's a lot harder to issue either a large number of citations or significant citations if you're not actually in the workplace. So if you really look at the first 3 years, it was relatively high numbers. As you can see, this year, through 6 months, OSHA has already pretty much equaled the amount of $100,000 cases that it issued in 2020. And judging from recent press releases, I think we're going to blow past that and come probably close to that record high. So what are a couple of other things that we're watching? I think Eric's already talked about. Certainly we've seen, and I'm fully expecting to continue to see throughout the rest of these 4 years, a significant increase to OSHA's budget, which will then mean with more money, that's going to mean more inspectors. More inspectors is going to mean more inspections, and that'll mean more citations. And if those citations continue with that same percentage, you're going to see more repeats and more 6-figure citation packages. We continue to watch and expect that at some point we will see the administration push for passage of the Protecting America's Workers Act. That may be a bit of a reach as the Senate is currently formulated, but it is something out there that we're watching. This is an act that has been introduced time and time again in the past. It's never passed, but at some point it's possible that it could happen. If it did, we'd be looking at significantly increased penalties, well beyond what we see now. A greater likelihood of criminal prosecutions in the event of fatalities and other types of incidents. Perhaps making it easier to prosecute individual managers for crime-related crimes. And then also expand the involvement of the workers as well as surviving family members in the course of the inspection. I mean, that already happens, but we're talking about giving them potentially greater input. So these are all things that would, in essence, I think, kind of bring OSHA a little bit closer to what we see in Canada, where $1 million fines for fatalities and amputations are pretty much the norm. We're also expecting to see the VPP SHARP programs probably come under greater scrutiny, making it very likely that harder to get in, easier to be kicked out. Continued increase and focus on criminal prosecutions, just as we saw during the Obama-Biden administration. Continued focus and additional resources afforded to whistleblower inspections. We've seen, as I said, talking about the guidance, COVID guidance, whistleblower and retaliation continues to be a focus, and I think it will be one throughout this administration. For those of you in the chemical and petroleum refinery fields, a more robust PSM, national emphasis program is something we're looking for. And then last but not least, a resumption or kind of reinvigoration of the regulation by shaming approach. Again, this is another issue that I think we talk about a lot. If you've joined us for past webinars, we've tracked the number and the tone and tenor of those press releases. And so if you look at the graphic here, under President George W. Bush, press releases were not something that were issued regularly. We saw an average of 148 press releases per year, and that basically tripled during the Obama-Biden administration, up to 460 press releases per year. So more cases are going to result in press releases. And certainly one of the things that we've always taken exception to with respect to these press releases is that they're issued with the citation, usually the same day, the next day, and they talk about the alleged violations as if they're a matter of fact, not an allegation that OSHA is making. And those press releases stay up there. They're in the archive. Your competitors can use them. It may show up on your wiki page, etc. They don't go away, even if the citation is ultimately withdrawn or vacated. And the other thing, as I said, we look at is and track is the tone and tenor of those press releases. Under President Bush, they tended to be pretty factual, more like a newspaper article. And then under the Obama-Biden administration, we saw a lot more, I guess, kind of the emotional language, the sorts of things that are truly intended to anger and inflame. I think that we continue to see those types of press releases, again, less frequently during the Trump presidency. Looking at a recent sampling, however, of press releases issued in the past month or so, it's as if they've retained a number of Hollywood screenwriters out there. We've seen things like an El Paso metal stamping manufacturer with a history of workplace safety violations failed again to protect its workers from the dangers of moving machine parts. As a result, a worker suffered the amputation of 2 fingers. Another, despite 2 inspections in 2020 that identified dangerous hazards, OSHA found a Milwaukee metal fabricating facility continues to put the workers' safety and health at risk. And I think my personal favorite With the holiday fast approaching, a 56-year-old worker could never have known he would spend Christmas Day in the hospital and die from a head injury. All making very clear that these employers knowingly or negligently fail to take actions to protect their employees. It's certainly the sort of thing that no employer wants to be on the receiving end of. That is something that clearly is going to continue and probably only become more common during this administration. So I fully expect that we'll meet or exceed the 463 press releases average per year, and that we're going to see the overwhelming majority of them contain that sort of language. So with that, I'm going to kick it back to Amanda to wrap things up.
Excellent. So the last section of our mid-year review is OSHA's regulatory agenda under the Biden administration. OSHA's priorities are under the Biden administration: equality, diversity, and inclusion. Looking to reinvigorate OSHA. They've had some of the lowest employment numbers for co-shows and staffing, attrition that have not been backfilled. So certainly looking to build back better. Their $100 million infusion from the COVID relief bill certainly went a long way towards helping that. They are seeking to improve compliance with the OSHA Act, and they think that the way to do that is through enhanced enforcement and basically being tougher on enforcement rather than compliance assistance, and enhanced support for frontline vulnerable workers in essential industries. And one of the ways that they're doing that is making retaliation clauses and making employers aware of what rights they have under the OSHA Act. So those are some high level priorities for this administration, and we're seeing them come to fruition in the regulatory agenda. Regulatory agencies are supposed to issue regulatory agendas twice a year. There's no set time frame. I think some of the agendas that we saw from the last administration, maybe we only had one, or it was very late in the year before we got the first one. But we do have the first one out, and we're starting to see some of the priorities, or what we expect to be the priorities of this administration, this Biden administration, the next 4 years. We expect them to pick up with PSM reform. That was something that was being done in the Obama administration. And then when we had the Trump presidency, that kind of lingered. There hadn't been a lot of action on it. We are anticipating that the Biden folks will pick that up again. Also, this was something that was in the Obama administration that they were in the process of updating or addressing as a result of case law to modernize the lotto standard and cut the term unexpected energization out of it. There was some case law with regards to it could not have been subject to the lotto provision because it was not unexpected. When a coil released, it was anticipated that energy would be released. Revisiting e-record keeping, that's already kind of started to come to fruition. OSHA's put out a directive to its compliance officers to ensure that employers that are being inspected have submitted their data to the electronic portal available on OSHA's website, and recommending certain citations that can be issued within 6 months of the due date. And they are also working with Congress to undo the Congressional Review Act repeal of the Volks rule, which curtailed Obama administration's extension of record keeping violations and making it a continuing violation under the retention requirement. Moving on to the next slide. This is also something that was in the Obama administration, and I mentioned earlier. Certainly let the folks and the Director of Standards and Guidance get a foot up on the COVID-19 ETS, the permanent infectious disease rule. There was a lot of talk about that in the Obama administration, especially with other viruses that had circulated earlier in the 2000s. Looking that they'll take that up again. Maybe that'll be something that comes out of the ETS. The ETS is only effective for 6 months, and then OSHA either has to come out with a permanent standard or revoke it. We'll see how that goes. Heat illness, that's another high priority of the administration, particularly of politicals there in the agency. A heat illness rule, that's something that California already has on the books. So likely to see some activity there with regards to federal OSHA. Workplace violence in healthcare, another issue that we think will come up. Updating of HAZCOM, that's kind of been around since the last big update of the hazard communication standard and the global compliance and the activities with that. Looking to see an update to align with the GSH Rev 3. And then also there's this long-standing and continuing interest in lowering chemical pills and action levels. It's something that's been tried, and it's difficult because you have to go through each individual chemical, look at the industries that are affected, do a cost analysis and technological analysis, and it has been a challenge for the agency to update or lower the pills to be more in line with some of the consensus standards that are out there. Moving forward.
I think that's we've come to the end.
Okay, we've come to the end.
Thanks everybody for joining us today. We encourage you to check out our website, conmosiel.com. We've got a bunch of COVID related resources and just general OSHA resources like an OSHA inspection toolkit and things like that. And very much want to encourage you to check out our blog, the OSHA Defense Report, and our companion blog now, the Cal OSHA Defense Report. We work hard to keep those updated and current, especially over this last year and a half. It's been like a full-time job trying to keep up with OSHA and CDC developments about COVID, but generally about everything else that OSHA is working on. And if you joined us today, I assume you know all about our 2021 OSHA webinar series, but we've got a bunch more for the rest of the year. We encourage you to join us for those. And I think we've kept you over time already. We did get a handful of questions in the chat function. We're going to reply to folks individually on those just to give you a chance to get out and enjoy the rest of your day. And thank you so much for joining us.